Hi everyone, I'm Olwen. I'm a paediatric speech pathologist. I'm also the clinical director of BackChat Speech Pathology, a paediatric speech pathology business based in Brisbane. I'm a therapist with 22 years experience and I'm also a mum of 3 boys, 2 of whom have a diagnosis of ADHD. Thank you to Selena for giving me this opportunity to speak on the ADHD Whisperer page. I really appreciate it and I really think I have a lot to offer viewers as both a parent but also wearing that therapist hat as well. So my eldest Jake is now 19, he's at university, he rock climbs all the time, he works part-time, he's got a lovely girlfriend, but at 5 years of age he was really different. He was a very different child. He was really hyperactive for starters, had so much energy, very impulsive. He was a lot of work. I knew at 2 years of age that something was not right because he was just so full on. All of his developmental milestones he reached so early. He was talking, he was walking, he was moving. He was just one of those kids who was a mover and shaker. He got everything and he got it really early. I was exhausted and I was a young mum and I was physically, mentally and emotionally exhausted by the time he was 2 or 3 years of age, and I took him to a load of therapists. I took him to speech pathologists, I took him to OTs, I took him to psychologists, we went to play therapists, we did everything. And at 5.5 years of age, we ended up in a paediatric office after his teacher, his lovely preschool teacher said to me, "Oh, Olwen, he's just the most delightful child, but he has so much energy, he is full on. He could run a lap of that school oval out there 3 times, and I don't think he'd be tired either. I think he could still come in and still have loads of energy." And I knew something at that point. I knew my gut feeling, that inner gut instinct that mums have. I knew that that was right, and everything I'd been feeling for the previous number of years was correct. So when we landed in the paediatrician's office, it was actually a relief, and for the paediatrician to tell me and give him that diagnosis, it was a real relief to me, and I felt like, oh, thank goodness it's not just me, there are other people going through this. But of course 15 years ago, which is when my son was diagnosed, but also we started trialling medication immediately because we'd been doing therapy for 3.5 years by that stage and we saw no improvement whatsoever. So in seeing the paediatrician, in trialling medication for the first time, it was a game changer for us as a family, but for Jake himself, it was life changing what it did for him. And over the last nearly 15 years, what the medication and also the advice and support that we've had from the paediatrician the whole way through has been instrumental in getting Jake to the point where he's at university, he's achieving, he's earning, he's learning, he's studying, he's got a lovely girlfriend. I know he's on track to have a wonderful life. So fast forward then another few years and we had another little man, a little guy called Rourke, a little one who was completely different to his big brother, a little one who was not oppositional, who was very compliant to the nth degree, very sweet, very kind, very caring, very passive, very passive. Lots of processing issues, even at 18 months of age when I picked up that something wasn't quite right. He was, really struggling with processing and with load, motor load, motor planning, motor sequencing, motor organisation, language. I could see that even though he was in this highly stimulating environment, I'm a speechy, I talk all the time with my children, and I could see even that he wasn't picking up on language. And it turned out that, a couple of years later, again with really intensive intervention from an occupational therapist, again input from a speech pathologist and myself, lots and lots of work at school, lots of work in his reading brain, it ended up that he also was really struggling with ADHD, But it's the type of ADHD that we don't see. It's the type of ADHD that flies under the radar. It's the type of ADHD that we don't talk about because it's not obvious. They're not the little ones in the playground who are oppositional or fighting, or they're not the kiddies in the classroom who are climbing the walls. They're not the littlies with the sensory issues. They're the little ones who struggle with learning. They struggle with the working memory part of ADHD, and in struggling with that working memory component of ADHD, they're very passive, they're very compliant. We call them ducks underwater here at BackChat because everything on the surface is very calm, but under the surface everything is paddling away, and of course that paddling is happening all up here. So with great early intervention, obviously, again, I picked it up at 18 months of age, years of really early intervention. By almost 6 years of age, I knew definitely that things weren't right. We had an appointment with the paediatrician and we got in around just before his 6th birthday. And the impact that early intervention has had, the impact that identification of the very passive, inattentive ADHD, and the impact it had on his language system because he couldn't focus, so he couldn't remember language. The impact on his reading acquisition because he couldn't focus, so he couldn't retain all the visual information for reading, but even in terms of that motor aspect, because he couldn't focus, he struggled to remember bike riding, scooter riding, skipping, hopping, the motor sequences and the planning that go along with all of those motor skills. Game changer for us as a family, me as a therapist working with him, because he wasn't retaining anything before we did a trial of medication. Afterwards, it was completely life-changing for my son. So again, thank you, Selena, for giving me this opportunity to speak and to present my two very different experiences as a parent on ADHD. It has many different faces. As a paediatric speech pathologist, I see the many different faces, the very different mixes and combinations, but I also see the smarts of the little ones who come into my clinics. We see the artists, the dancers, the singers, the drawers, the sketchers. We see the builders, we see the smart little CEOs, and I'm a big believer in focusing and celebrating on the smarts of our children and not focusing on those things that they struggle with. It's about tweaking those weaknesses and making and celebrating those smarts that they have. Thank you so much for your time. I'm happy to have a chat. Anybody interested in talking further, please feel free to PM me on the BackChat Speech Pathology page. Thanks, Selena, for inviting me to present this clip for ADHD Awareness Month. Bye, everyone.